He had performed more than 80,000 angiography and 40,000 cardiac procedure. Dr. Darshan Bankar sir, please.
Slide है सर. Yeah. ये pointer है.
Good afternoon. I know after having so much of insulin and so much of motivation, it's difficult to concentrate for a scientific topic now. And as the time goes by, and with so much motivation which has come to your life in last 15-20 minutes, many of you must be thinking that they should stop practicing also. So, let me define my happiness. I am happy when I treat patient and patient gets cured. That is number one happiness for not only me, most of you. And the biggest sadness in our life is when we fail to cure a patient. Okay, so that is our definition of happiness and success is when you treat patient and patient gets cured. That's how we look at it. The topic is very interesting. Many of you know about it. I'll just go and brief you about it. It is Eureka. You know what is Eureka. I think most of you will know what is Eureka. Eureka is the exclamation for something which you have invented or found out, which was already existent. The idea was Eureka is basically the word which was used by a Greek mathematician, Archimedes, and he was in the bathtub, and then he found out when he went inside the bathtub, the water spilled out. And so he found out a method to measure the volume of the water. So he, in joy, he ran on the street naked directly from the bathtub telling Eureka, Eureka. That's the story. So for medical field, this therapy is like Eureka. It's the hope of Ray, what we call. And starting with, we have huge number of patients we all know is having hypertension. Many of them are treated and controlled. Many are treated but uncontrolled. And almost 1/3 are untreated. And apart from, like diabetes, hypertension also is one of the leading cause for all the morbidities and mortalities happening in lifestyle diseases. So this is how we look at it. I would request people not to please, just keep your silence please over here. There has been a lot of things which is happening in blood pressure, you all know. I'm not going into detail of this because I don't want you people to get bored with science and data and the analysis part of it. I just want to show you something which is happening now in the world, in India and in city of Baroda. So we have a lot of challenges in treatment of blood pressure. The thing which is very important and many of you must have faced, how many of you see resistant patients with hypertension? Most of you will see, like patient is already on 3 or 4 drugs, still his blood pressure is 180, 110, 200, 120, he is on all the drugs, still nobody can control. That is what we call hypertension. I am not going into detailed definition of this. But in general, patient with 3 or more drugs, the uncontrolled pressure is a resistant hypertension. And for such patients, we have a therapy now which is available. And you will be surprised to know almost 10 to 15% of the population, hypertensive population, has resistant hypertension. So which is quite a big number, especially in India. There are various therapies now available for hypertension, like barrier is reflex amplification therapy, AV fistula creations, carotid body ablations, but the most important and most performed therapy now is renal denervation therapy. So what does it do? I'll just give you the brief what renal denervation do. So basically renal denervation is ablation of the renal sympathetic afferent nerves. So the central sympathetic drive origins from the kidney. So what we do is the sympathetic nerves over here are ablated at the kidney level only. So the sympathetic drive does not go into the brain, and we understand the central neurogenic mechanism is abolished for causing hypertension. So obviously there are many advantages of this thing. So basically there are sympathetic nerves are adjoining, or it is just outside the renal arteries on both sides. So we can do a percutaneous catheter-based technology where we can ablate these sympathetic nerves on both sides of the renal arteries. That is what the principle of renal denervation therapy is. It has been used for various things now, for hypertension, for sleep apnea, for post-MI patients, cardiorenal syndrome, and insulin resistance. These are the umbrella where we can use, wherever there is sympathetic overstimulation, you can use this therapy. Obviously, I have already told you the anatomical location of this thing, and this is how the catheter looks like of the renal denervation therapy. The procedure itself is not very difficult. It is like very safe procedure and can be performed maybe in 1 hour's time. And now the technology has also advanced to a very great extent for this therapy. Basically, it's a Medtronic Simplicity catheter system which we are using nowadays. And it has a multiple discrete treatment points over here. And the therapy with newer generation of catheter. And the catheters has a AI technology inbuilt. So it can sense the temperature, it can sense the amount of energy given. And the catheter itself decides how much energy has to be given. So that kind of catheters are now available and which we are using already. And with that therapy, it has become more effective and the procedure has become more successful. This is one of the cases which we did recently. Mr. Bepiwala, with 52-year male with 220 pressure and was on multiple drugs, and all secondary hypertension causes were excluded. And we put a catheter inside the renal artery, and then what we do is we put a renal denervation catheter and impart the energy into the renal arteries so that all sympathetic stimulations or all sympathetic nerves lying adjacent to the renal arteries are ablated. So it is done on both sides, left and right renal arteries. And this was post-procedure day 2. The pressures were 140/90 almost. Patient was already on only 2 drugs. And at 6 months follow-up, we had patient controlled on 140/90 pressure for almost 6 months. So that is wow. This is very interesting case. That is why I put this case. This is a 70-year-old female. She was obese, diabetic, weight of around 115 kg, and had an obstructive sleep apnea also. And she was from Valsad, and we did 180/100 pressure on 4 drugs, and obviously she was on multiple oral hypoglycemic agents also. And we did this thing, and this was like I was one of the first in India to do this renal denervation therapy. There is a story behind it that I was, my wife was watching TV, BBC, at one point of time, and she saw an interview of a cardiologist called Horst Sievert from Germany, and he was talking about this technology on BBC. So she told me that such thing is happening. So I contacted him through email, and he replied that we are going to have the first learning session for all over the world for renal denervation therapy. Why don't you join? So I was the first one in first 50 cardiologists to be trained for this therapy in 2011. So that's how I started doing renal denervation therapy. Now the issue at that point of time in India, the catheter were not available in India. So obviously as the Indian, we know how to jugaad things. So I thought about it, and we use, ablation catheter in EP studies, RF ablation, which was like everybody does it for years to now. So what I did initially for few cases, that I use a RF ablation catheter of the heart into the renal arteries. And we did almost 25 renal artery ablations using RF ablation catheter of the heart, used for EP studies. And we were successful, and we did it quite regularly at that point of time. Then we got this newer catheter available in India, and now we are routinely using that catheter for all our renal denervation therapy. By now we have done almost 40-45 renal denervation therapies. Almost 30 patients are still in follow-up. The rebound hypertension happened in almost 6 patients at the end of 3 years, almost average of 3 years, that their blood pressure came back to we went to square one. But almost 20 to 25, that is almost 60% of the patient, the resistant hypertension had gone out of the work. So there are various studies done for this thing, simplicity trial. Initial results were not very fantastic, but the newer trials have shown a very promising result. And my personal experience of 50 patients we have one of the largest series in India, and our experience has been very gratifying. If you select your patient properly in such cases, you get a fantastic result, and it gives a long-term result also in such cases. And the newer generation of catheter, the success rate has gone up like 98 to 99%. So in conclusion, it's a novel and safe approach. It is absolutely safe form of therapy, and selective denervation of renal sympathetic nerve is a potential to reduce significantly the blood pressures, and obviously it is one of the major therapy available for resistant hypertension. And various trials and current guidelines have recommended renal denervation therapy should be used for resistant hypertension. It has already come in the guidelines now. And this was my attendance certificate. And I thank you all for patient hearing. Thank you very much. Any questions?